In my previous video, I talked about the different types of early pregnancy failure. Two out of the list I gave got a lot of traction: blighted ovum and missed miscarriage. I saw some questions and a lot of confusion, so I decided to make a new video to explain them extensively. Hi, my name is Chinaza. I am a medical sonographer, and on this space it is everything ultrasound. In today's video, I will be breaking down blighted ovum and missed miscarriage in simple words so you can understand the difference. What is a blighted ovum? A blighted ovum is also known as an embryonic pregnancy. This happens when a fertilized egg implants in the uterus and a gestational sac forms, but the embryo never develops. To break it down in simple words, for conception or pregnancy to take place, the ovary releases an egg. This egg that was released is fertilized and moves to the womb. Before a baby is seen in the womb, certain conditions need to be met. One of them is the formation of what we call the gestational sac. This sac is what houses the incoming baby, and the process is not automatic. It takes at least 4 weeks above for the baby's house called the gestational sac to form. Now, let me clear some of the misunderstanding I saw in the previous video. What this means is that if you do a scan too early, even if your pregnancy test says positive, ultrasound may not show anything. If you do a scan in the first week, the second week, third week, and sometimes even the fourth week, you will be told there is no evidence of pregnancy. This is not because you are not pregnant, but because the first structure is yet to form. It is completely normal and there is no need to panic. This is the normal pregnancy progression. Like I said, the formation process is not automatic. The sac begins to form anything above 4 weeks, so you will most likely be asked to come back for a repeat scan. When this sac forms from 4 weeks above, it is usually empty until around 6 weeks 5 days, 6 weeks 6 days, or 7 weeks. Again, let me clear another misunderstanding. It is completely normal for a sac to be empty between 4 weeks to 6 weeks and some days. This is normal. Most times, some sonographers don't explain this properly and patients end up living confused and scared. Now, once the pregnancy gets to 6 weeks 5 days, or 6 weeks 6 days, or 7 weeks, this is when the owner of that empty house moves in to occupy it. In the case of blighted ovum, even when it is now time to see the fetal pole inside the sac, that's the baby, the sac is still empty. But we don't conclude so fast. We will still ask you to do a repeat scan in 2 weeks, just to be sure it is not a simple delay. We only conclusively say it is blighted ovum or an embryonic pregnancy when we measure the sac and it is above 2.5 centimeter or 25 millimeter, and the pregnancy is about 9 weeks above, but the sac is still empty. That is when we call it a blighted ovum or an embryonic pregnancy. So please, don't be in a hurry to panic, especially when the scan result doesn't meet these criteria. Ultrasound findings of blighted ovum includes an empty gestational sac that measures above 25 millimeter or 2.5 centimeter that corresponds to 9 weeks pregnancy, no yolk sac in some cases, and no fetal pole, that is no baby. The sac may continue to grow initially, but it will be empty. Note that the house was built, but no one moved in. Now to the next type of early pregnancy failure, which is missed miscarriage. What is a missed miscarriage? A missed miscarriage is when the embryo is actually formed but stopped developing and there is no heartbeat. In this case, the house was built, that means the gestational sac is present. The occupant moved in, that is, we see a fetal pole, a baby, but we don't see the baby's heartbeat. This shows that the baby is no longer alive. This can happen anywhere between 7 weeks above. And ultrasound findings include present gestational sac, the fetal pole is present, that is, the baby is present, but no cardiac activity. We may also see a yolk sac, but the growth has stopped. This means that the baby started developing, but stopped growing. And like I mentioned in the previous video, most early pregnancy failure happens as a result of something outside our control, and there are no medications to fix it. The only solution is to terminate the pregnancy. In some cases, there may be no symptoms, and in some cases, after a while, bleeding could start. This is the body's way of removing a pregnancy that is not doing well as it should. And not every spotting or slight bleeding indicates a problem. Please note that. Some may just be implantation related and there is no cause for alarm. Just get a scan done for confirmation. So in conclusion, for blighted ovum, the gestational sac is present. it measures above 2.5 centimeter or 25 millimeter, and the pregnancy is 9 weeks above, but no baby inside the sac. For missed miscarriage, the sac is present, the baby is present, but the baby has no heartbeat. The baby is no longer alive. I saw a lot of panic and poorly explained results in my DM and a lot of confusions and questions in the comment section. That is why I am making this video, and this is why ultrasound is very important. So whenever you are giving your ultrasound reports, please go through it to ensure that you are not misdiagnosed, to ensure that there is no reason to panic, and to ensure that you understand what was given to you. And if you don't understand, ask questions, because sometimes these things are reported wrongly and there may be a need for you to get a second opinion. If you found this video helpful, follow for more simple explanations about ultrasound and women's health. And if you have any more questions, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and I'll see you in my next video.